Now turn our attention to a panel discussion exploring how AI and biotech-driven advances in genomic diagnosis are enabling early interventions and more targeted healthcare solutions. And for this discussion, please do welcome to the stage Dr. Karolina Kobus, Chief Scientific Officer at Lifespan Group, Mark Stoesz, the President of Enterprise Solutions and Partnerships International at GE Healthcare, and of course your moderator, Dr. Nigel Beejay, Consultant and Digital Health Expert in AI and Bioinformatics at Emirates Hospital. Please do give them a round of applause.
Hi, good afternoon. Salam alaikum. I'm glad to introduce you to this session. And after your lunch, I'm sure you're feeling quite sluggish, but hopefully you've woken up after the drums. So we're here to talk about a little bit about the next frontier in genomics, an advancement in genomic diagnostics. And I have two experts here, both of them experts in genomics and some of them experts in imaging. But I'm going to speak to you, Karolina, first of all. I know that you do a lot of genomics in Dubai. You've been there for 2 years. You've been doing this for a long time, and you have a lot of expertise in this. And I wanted to ask you, after the human genome project was completed, it led to many unprecedented opportunities. Can you tell us a little bit about how this genomic data that you're capturing in Dubai can be integrated through AI platforms to improve patient outcomes and improve treatments?
Thank you, Nigel, for a nice question, and it's very important how we are going to translate actually these national genome projects which are happening across the globe. We have Emirati Genome Project, we do have England Genome Project, which was the first and the oldest genome project worldwide. And now it's a time to translate actually this data into the clinical practice. So definitely one of the application is upgrading and boosting the traditional screening programs, like newborn screening program or premarital screening program, by incorporating genomic testing into that. Thanks to that, we are expanding with a number of diseases to be detected and comparing to the traditional methodologies which are very limited. So that's one of the example, newborn screening programs or premarital screening programs. Yet another diagnostic, because this is more preventive application of the genomics and AI softwares and machine learning. But if we talk about the diagnostic, I would say oncogenetics, pharmacogenomics, this is the best examples how we can incorporate and translate the DNA data into the clinical practice, where the physician actually can select the treatment, oncologist can select the targeted treatment more precisely way with much fewer side effects. And the same for pharmacogenomics, actually, where we can detect the adverse effect of the drug and also identify the slow metabolizer and fast metabolizer. And based on that, the cardiologist or any other doctor, other physician can adjust the dose.
That's fascinating. I mean, pharmacogenomics is so interesting. And I'm now going to shift to you, Mark. I mean, Marcel Proust said, the real voyage of discovery is not in seeking new landscapes, but having new eyes. And now with the current new eyes that we have in terms of imaging, can you inform us and tell us a little bit more about how imaging from the GE perspective informs genomics, and how are you using the AI within GE?
Thank you very much for the question, and thank you everyone for the opportunity to talk a bit about where we see what the challenges are today that we face, which is how do we take all this data that we produce in a hospital system. And if you think about the hospital system, it's on average around 130 or so is what the statistics say, terabytes of data every day. So it's 50 plus petabytes of data each year. Why is that an important standpoint? And I think it becomes very important to look at because of that data silos. So we have different data sources. So we have genomics as one piece. We also have blood biopsy, all the blood tests that we have in samples. We have the information that we get from clinical systems, the informatic about what you do, your lifestyle, all the other pieces that might be of interest to understanding the disease. And then, of course, we have things like imaging, whether that's MRI, that's CT, a basic X-ray, or ultrasound. And these are all data sets that are there and operated right now, on a majority of the time, as individual pieces. And that means that we're not taking advantage of this, what's now called multi-omic approaches, which is how do I combine this information from the blood, from the genomic, from the patient history, along with the imaging studies to better understand what's going on with that patient. Oh. And from that standpoint, if we do this in a controlled and operationalized way, we can actually add more efficacy for understanding the disease. We can understand what is the right treatment for that patient. So now we start to think about things like predictive and also patient-centric medicine. So we know, let's take an example of prostate cancer. Instead of having 6 treatments of a theranostic agent, maybe this patient, based on their history on the genomic plus the blood, all the different understanding of the patient, maybe they only need 3 treatment sets. Okay. So we can start to move to a predictive medicine if we use the opportunity of multi-omics together. Imaging brings data together from an image standpoint that we can understand the texture of that patient's physiological or anatomical specific areas. When we take that biomarker and tie it together with other things and using AI to do that for us, we can improve the quality of outcomes.
Right, that's fascinating. So basically what you're saying is that when it comes to kind of looking at human health, it's kind of like a jigsaw puzzle with different pieces of the puzzle. And before this, we didn't really have the pieces of the puzzle connected, but now we're able to bring those pieces of the puzzle together. Is that what you're basically saying?
Much simpler, better response.
All right. So in that case, if we have imaging as one of the pieces of the puzzle that we're looking at humans are, we have wearables as another one. Karolina, we have the genomics, genomics and genomic data. What other things do we have?
And proteomics,
and yes, that's what I'm trying to say.
Yet another omics, actually.
So what are these omics? Because it's tell me a little bit about what these other pieces of the puzzle are. Proteomics, metabolomics.
Yes. So actually, this is definitely what we learn. The completion of the whole genome project finished in 2003. So actually, it's already 3 decades of the genomics, correct? So what we learned that genomics, it's not enough. So it's too static to understand the biomarkers and the mechanism of the disease. So definitely, that's the reason other omics pop up. So we have proteomics, we have metabolomics, we have epigenomics, and so on. But proteomics is the easier way, and protein itself is the easiest way to catch the dynamic biomarker of the state of the health and disease. So that's the reason, for example, the England Genome Project currently is enriching its data by the next generation proteomics, combining this with the imaging data and other data, healthcare data information. And all this together is generating terabytes and zettabytes of data itself, and definitely to get any meaningful information and outcome from all this omics information combined with imaging. We need machine learning and we need AI algorithm in order to understand the language of the cells, language of the genes, language of the biological organism. Because at this current moment, it's still uncertain and it's still we are not there yet, I would say. So genomics is the great basis to start, but then we need to build on that in order to really create preventive, predictive disease models in the future.
Okay, so I'm just going to put a very simple question here, because I don't know much about this. So let's say, for example, that I did a genetic study and that I had a gene for Alzheimer's, in my genome that was analyzed. Is that important, and does that mean that I will get Alzheimer's, or how does that impart with the proteomics and the metabolomics? Can you kind of explain a little bit, Mark, about where that figures? Am I finished, or am I going to survive, or do I need to do further testing?
The good news is, most likely, you're not finished, so that's a positive piece. I think, when we take this from a baseline standpoint, you have the genomic indicator that says I might be potentially to have Alzheimer's as I go through. But there are other things that we have to also take into account. Lifestyle, when and how you, let's say what we see now is exercise being a major piece of that. We also understand that reading and other things are going to have an influence on what the next level of conditions you have. So your surroundings, your habitat is going to be a major driver of how this could potentially progress into Alzheimer's. And I think some of the things that we're very actively looking at is also in that prediction using other tests. So we have the genomic information that we have, but that doesn't give you 100%, okay, you are going to have Alzheimer's. So what we're actually working on is other agents to actually look at diagnostics. So if we take a look at some of the agents for PET-CT, these radioligands that we have that can actually look at different parts of the brain, and specifically looking at different cell lines in the brain, that we can then, from those information, have a better prediction that there is an event, whether that's dementia or Alzheimer's disease.
Oh, you mean kind of like metabolism in the brain?
Yes, so
like
exactly.
FDG PET and things like that.
Correct,
okay.
And there are some also specific agents that we are now developing, whether it's a tau agent or other agents that are looking at a specific cell line that then give us an understanding, yes, this is actually a marker in the brain of this cell line that's based on metabolic uptake, that we understand that this patient has a stage of disease that's beyond just conventional aging aspects. Now, why is that important? Is in the past there was no treatment, and now we also have lecanemab, which is now approved in many countries, that allows us to actually control the advancement of the disease, which then requires us to also look at follow-up of that to make sure that the progression is not having any contraindications where we might see some other effects due to this agent that we're injecting. So I think the starting point is having genomic information, tying that to different outcomes. So we also need to look at when you have a physician environment and also home environment that you're acting in a certain way, so to improve the potential that you have for managing any progression of disease, and then better understanding of that disease as it progresses with modernized testing with AI tools that we can actually do better prediction as well based on certain measurements of the different structures in the brain that might be indicative.
So I guess that's where the AI becomes really important, because with these petabytes of data, so much data that we're looking at from all these different pieces of the puzzle, we need the AI to kind of help interpret or extract information from this data. Is that the correct analysis, Karolina?
Absolutely. So without AI, without IT, without softwares, without machine learnings, we will not be able to interpret this data. And it's not only about the interpreting the current state. It's about to feed this algorithm and machine learning softwares in order to learn, to give them information so they can predict. And we can move even from reactive to proactive, and even to the preventive measures and approaches in the healthcare system. I think this is the objective and ultimate aim, to be preventive, not even proactive.
Okay. We've spoken a little bit about Alzheimer's or neurodegenerative disease, both of you, but I know that in our previous discussions we were also talking about the beginning of life. Can you say a little bit about what GE is doing in terms of diagnostics there, and then to Karolina?
Absolutely, and I think here's where I think there's a lot of opportunity for addressing a very, very challenging situation when we have a mother who's with child, and understanding if there's any type of potential birth challenges as we go, whether that's things like preeclampsia or postpartum hemorrhage, which normally we are seeing very late stages in the pregnancy. So when you're getting to the last trimester, you start to recognize these situations where you have some other impactful things where maybe you end up in bed rest in a hospital, et cetera, with a monitor on the patient. And it's can lead to much mortality, especially in low middle income countries and even advanced countries if you were to consider the US. What we're looking at is how can we take advantage of whether that's genomics, blood samples, understanding glucose measurements, all these urine tests, et cetera. Can we take that along with ultrasound information, understanding the gestational age, other types of predictors, and start to look at a prediction algorithm that allows us, instead of waiting till we start to measure and put for those of you who might have seen this, you have a monitor on the patient, on the belly of the patient, looking at the fetus as well as the mother. That's at the late stage. How do we look at creating an environment where we can actually understand what patient population is at risk, and then create a wearable device that we actually bring it back into the community so that you don't wait till the last stages when the mother is in the late stage. We can start to look at this earlier in prediction. So that's to the point that Karolina brought up about how do we look at it from prediction, prevention, and then from that standpoint, we can earlier investigate the patient, manage the patient's situation, and hopefully at that point be able to manage the mortality as well.
It certainly sounds like a fascinating, really, an element, but I think we're out of time now. But I must say that I think the combination of like the expertise that we have in this country together with developments in AI as well as the quantum computing mean that we have the perfect situation to go forward in this area. Thanks very much.
Thank you.
Thank you very much. Thank you.